We knew something was coming and we started preparing for it in the February. It's a respiratory disease, we know how to treat this.
And you recognise what's happening abroad and you think to yourself, well, they're just not getting it right, we'll be okay. And then 1 became 2, became 4, became 10. And then you realise that we're right in the middle of it.
It very clearly became obvious that a lot of the conventional treatments that we'd always relied on didn't work.
I was really feeling completely overwhelmed and not being able to control things in the way that I normally do. And seeing all of our normal structures that do control things falling apart.
Everybody, even those who didn't have any ICU backgrounds, they had transferable skills and we could utilise that.
It was hard, but you wanted to be part of the response.
Because you've got to get involved. It's not about me anymore, it's about the community, it's about playing for the species, aren't we, with a pandemic.
I was 15 weeks working in intensive care. Even now, it was a hard time.
No one would ever understand what you were going through the same way that your colleagues would.
This is a very difficult time. Even your children is scared of you because you are working in the hospital.
I think I lived on adrenaline for about 3-4 months. At times I've kind of blocked certain bits out of it because they were so draining.
Some of the things, even the negative things you don't want to think about, it will still stick with us and remember it for the rest of my life.
Getting the investment from the charity to have a permanent team of psychologists available for staff as well as patients, I think is critical.
Psychologists help teams with debriefing after difficult incidents or simply with reflection sessions, and I think that's been a really positive change. We've had fabulous donations from Barts charity that have helped us to upgrade some of the staff facilities. We've set up wellbeing hubs.
We want those wellbeing hubs to be a permanent feature of the hospitals as a bit of a statement of gratitude for all of the service that they've given.
You really felt in the darkest of days that everyone was rooting for the NHS and that made a huge difference.
It was nice to see that in a moment of crisis, the vast majority of people really rallied round in an extremely positive way.
We all formed a chain, each of its links. There were strong links.
There's a sort of modesty around, well, we're just doing our jobs, but of course it was so much more.
We thought people had got to the end of what they could give, they just found more.
In 5 and 10 years' time, our teams will be the teams that are teaching. They will take all of this learning and be the generation that tackled the pandemic and learnt on the hoof.